I'm saying there's a role for parents. If the child is very resistant right now, do not push him to go to therapy. I want to understand this child. What are her needs? And how do we set up the best plan for this child at home, with peers, with family members, respecting her comfort, but also the school-based accommodations interventions. They need to be in place.
Welcome back to another episode of Unspoken Words, a new edition production hosted by Dr. Alicia Shippon-Blum and the Smart Center. This episode features our latest installment of our Ask Dr. E series, where we answer questions from our listeners. In this episode, we answer 5 questions, including how hard to push your child to go to school, what to do when your child's psychologist isn't really helping, ways to reward talking without bringing too much attention to it, and more. Before we get started, remember, you can ask Dr. E a question of your own. All you have to do is head to selectivemutismcenter.org/Ask Dr. E, that's ASKDRE, and enter your question in the form. We read all of your submissions and do our best to answer them on podcast episodes, blog posts, and on social media. And speaking of social media, for the best of this episode and every episode of Unspoken Words, make sure to follow the podcast on Instagram and YouTube. On Instagram, we are at UnspokenWords_podcast, and on YouTube, we are Unspoken Words Podcast by Dr. E. All right, without further ado, please enjoy the latest episode of the Unspoken Words Podcast.
Hey listeners, before we get started, I want to tell you about Communicamp, our 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. It's over 16 hours of parent education and support, as well as 16+ hours of treatment for your child or teen. Spaces are limited and spots book fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice. Okay, now enjoy the episode.
Hey, Dr. E.
Hey, Brandon, how are you today?
I'm doing good, enjoying the fall weather. Are you excited for another Ask Dr. E episode?
I'm always excited for all of my podcasts. That's why I say that at the beginning of every podcast. I'm so excited about. One of the nice things about Ask Dr. E is that these are actual people writing in the questions. And so for me, I know that I'm answering somebody specifically, and I find that really rewarding. So that's why we do it, because we want to be able to help people. So I am excited about these questions. So let's get started.
Yeah, well, we did a nice listener questionnaire, I think like 2 months ago now. And one of the main pieces of feedback was people love the Ask Dr. E segment. And so we've been getting a lot of questions on the forum, and we're going to do these more often. So we're trying to do these once every other month. Yeah, we're excited about it. So, all right, you ready to get into some questions from the audience?
Let's go.
All right, question number 1. My 4-year-old daughter has a mild form of SM, mainly with adults. She talks to her friends both in the home and at school, but she only communicates nonverbally with teachers. I recently heard about a therapeutic approach called Snoezelen, which focuses on treatment through sensory processing. Have you heard of this, and would you recommend this kind of treatment for SM?
Hi. Well, Snoezelen, let's spell it for our listeners because it isn't something you hear often. It's Snoezelen. It's a controlled multi-sensory environment type of approach. It's a very non-directive approach. In other words, it's a sensory environment that you'll place somebody with sensory processing challenges into this room that's got a lot of sensory stimuli. And what it's supposed to do is supposed to allow in a very non-directional. The therapist does not direct you in that room, to just kind of acclimate, get connected to, adjust to, seek out whatever you need to do. It's often recommended for individuals on the autism spectrum or with severe developmental disorders. So this particular parent did not indicate that in this question. It doesn't mean that that's not part of the case, but no, I have not used this. I do not use this to treat SM. What I do is I use social communication anxiety treatment, a very CBT-based approach that helps with the understanding of SM, what factors lead into it, and actively work to help that child make the progress into speech by training teachers, training parents, training others on what strategies and interventions are being used. And the reason I'm going on and on about that is that whatever this treatment is, whether it's Snoezelen or listening therapy or equine therapy or music therapy, all of that are adjunctive treatments to help with certain situations or conditions that a child has, in this case, sensory. So they're using that as an adjunct, but that is not the treatment to treat SM. The social communication anxiety needs to be kind of dealt with head on. The sensory aspect is helping the sensory for sure. So it's in this case, they recommended Snoezelen. I am not going to say whether I recommend that or not for this particular child, but I would not rely on this sensory based treatment to treat and what I would call cure SM. Absolutely not. Unless they're doing interventions, that's how you have to see it. And I think one of the reasons they're recommending this particular treatment is that it's a nonverbal based approach. And so you're almost keeping the child nonverbal, placing them in a sensory environment to deal with their sensory. So if that family wants to add this as an adjunct, fine, but I would certainly be addressing the selective mutism. And I do want to touch on one thing, Brand. I know we have a lot of questions, but when I hear this child is 4, maybe 4.5, almost 5, I'm not sure. 4 years ago was COVID. And what happened then is over the course of the next 2 years, there was very little interaction with many individuals, children with adults. And so what we're seeing in like the 4 to 6 year old range are a lot of kids that have a lot of difficulties with adults. Think about it. If your child was 1 and you guys are wearing masks, what are you saying when they got near an adult? Get away, be careful, wear your mask, wear your mask. And so what we're finding is this kind of being afraid and not as comfortable with less familiar adults. So definitely part of the treatment will be building social connection, confidence, engagement with more adults. And in this case, training teachers on how to build that connection, comfort while respecting their baseline stage, which is nonverbal, and using strategies to help progress that child. No child will stay mute if you're doing the treatment. They won't. And the school-based accommodations interventions. So the angle isn't treat just the sensory. It's certainly treat the sensory, but even though it's mild SM, you definitely want to focus on building social communication, confidence, and skills.
So we have a bunch of questions, so I don't want to linger too much on this one, but I did want to call out that this question did mention that she has a mild form of SM. So it sounds like she's talking to her friends in school, but not talking to her teachers. Do you see that a lot in your practice? Did you see a lot of mild SM? Is this common?
She's saying mild SM. I think what she's saying is maybe she does talk to a couple peers. I don't like to rate a severity without understanding the child because we'll have children that present as completely mute, but their case is very straightforward. And to me, it's not difficult to treat. And in a few sessions, you'll see progress, assuming the goals, strategies, etc., are being done, school-based accommodations, interventions, and the child
Mhm.
can overcome it, even though they may have presented completely mute in school. Where you talk about severity may be age related, the older, the more conditioned, but it also could be the comorbidities that that child is struggling with. So a child with severe learning challenges, that's going to be a more severe difficulty in presentation, maybe expressive language or speech and language difficulties, maybe a child being on the autism spectrum and having difficulty in motivation and understanding the social puzzle. That to me is how you have to look at it. And really, with what you kind of see from the evaluation, you can give a parent an idea about how long this should take, assuming they're implementing the strategies and interventions, and assuming the school is also providing the appropriate accommodations interventions. So I don't want to get caught up in the word mild here.
Let's move on to question number 2. We came from Latin America 14 months ago, and my 14-year-old son hasn't spoken at school since the first day. Social anxiety has built up, and he's now scared to go anywhere with us. He's only going to school now 1 to 2 days a week for a couple of hours. He says it's too difficult. School has no idea how to help. So here's my questions. Should I keep pushing him to go to school? He doesn't seem to want to go to therapy, but should I still take him? He's always in his bedroom with the door closed. Would it be a good idea to push him to at least keep the door open? A lot of stuff there.
A lot of stuff. This is a loaded question, right? We could spend an hour just on this question. Here's what I'm thinking. Her son is 14. He was at basically 12 and a half, maybe, let's say, maybe 13 when he came over here. He was speaking most likely a different language. So you're a preteen or teen, you've got your friends, you're used to that environment for your entire life. You're up and lifting to a whole nother country, not even a neighborhood. That's hard enough. You're leaving family, you're leaving friends, you're leaving comfort, connection. And if you already have a predisposition to being selectively mute or socially anxious, you can imagine that this is now literally exponential. So it's a very difficult time to make transitions for children. I mean, think of yourself when you went from elementary to middle school. You may have been in the same school. That was hard enough because it was a new building. But imagine kids that are in elementary school and they go to a whole new building with a bunch of new kids. That's scary. Well, this kid didn't just do that and move across the city. He moved to a different country with a different culture, with a different language. So I'm thinking this is really tough. And this child is now being very avoidant because he feels very, very out of control. So the therapy needs to not only be to help him with his anxiety, his feelings, but also the parents. I'm sure there's a lot more to this question than what the parent is sharing. And I'm sure they're working actively with him. So kudos on that. But what I'm hearing, it sounds like there may be a bit of a misunderstanding to the degree of suffering that this child might be going through. So an outside therapist for sure needs to be involved, but also he may have some resentment towards his parents. He probably had very little say in the move. And maybe he's resenting this process. You took me from everything, everybody and everyone I know. Now, this family, I'm not going to get into the dynamics. I don't know this family. Maybe the child was excited to move. And sometimes kids will say they're excited, but when they actually move, they realize, whoa, this is hard. Also, entering into a school at this age with kids that may have known each other for many, many years is also hard. Not only did he leave, but now he's entering. So he's feeling incredibly disconnected. So what needs to be is one, I don't know if he had SM prior to this. It sounds like he did. And it sounds like he has obviously social anxiety. They need to be working with a therapist that really understands their child and can really understand what's going on from a social communication standpoint and overall anxiety standpoint, but also very sensitive to what's going on, but working very closely with the school. It sounds like because he's got almost this school avoidance, school refusal, really working with the school to see how, one, that he can be educated, but how do we transition him in a way that he feels safe and in control? And when I'm working with teens, I'm working actively with them on their involvement in this transition, not just you need to go, you got to go. Monday morning, you got to go. I'm going to give this to you if you go, or it's not, I don't want to ever use the word disrespectful because it sounds wrong, but I've got to really respect where this kid is and involve him in it with us guiding the process so that he feels part of it. And what the parent may be saying is he wants nothing to do with this. He doesn't want to go. We're lost. We don't know what to do. That's where parents need parent coaching and training. So seeking that out through a professional that's familiar with this disorder is really important so the parents can be educated on the sidelines on how to help this child, even without his involvement right now, if he's very much unwilling, because he's not 5, he's not 6, he's 14. You can't drag him into therapy if he's not ready for it. But we've got to help the parents get him ready for it or train them on how to deal with this and work on helping him get into school by working specifically with the school. And he'll probably need an IEP and he might need some home study and ways to build peer connections. This is a loaded question. I mean, we need to get them connected with peers. We can't just throw them into a big classroom because remember, progress and comfort does not start in a big group. It's comfort precedes communication and progress doesn't happen in a big group. So we've got to build connections, build comfort away from the group through the buddy process, through the small groups. There's so many things that can be done. So what I recommend this family does is really seek out help.
So to summarize what you were saying, should I keep pushing him to go to school? Kind of, but also understand and respect where he's at and try and get him treatment. So the answer to the second question, he doesn't want to go to therapy, but I should still take him, right? The answer is yes. And then he's always in his bedroom with the door closed. Should I push him to keep the door open? You didn't really comment on that. Do you want to make a quick comment on that?
I would back that up and say, no, I don't want you to push him to go to therapy if he isn't willing to go. If you take
Mm,
him to a therapist and he's shut down, I'm saying there's a role for parents. So if the child is very resistant right now, literally digging his heels in, do not push him to go to therapy. What I would do is talk with a therapist yourself as a parent to get some strategies, interventions to help guide the parents to the next steps. It might be that a therapist comes over. There's lots of things we can talk about, but I would not push him and make him do anything until we can be educated as a parent. In addition, talking to the school district about alternative means of schooling and educating and beginning to put the plan in place, even if he is not doing it. And as far as in his room, he's avoidant. He's sitting in his room with the door shut. Kids deserve privacy, but he can't be spending his entire day there and night there. This is where, again, the parents to me from this question need the most support and parent coaching and training. Hey, listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode.
Let's move on to question number 3. My daughter is having issues at school. She is nonverbal and the teachers are not cooperative and consistent in their efforts. I have given them reinforcers to give to my daughter when she attends the class, but they are just not regular with it. Is there anything else I can be doing to inspire my daughter to go to school?
So what we're doing is similar to the question before. We're trying to say to our child, go, right? But when I say go to that child, that is maybe in an environment that is not set up the way it needs to be. Are there accommodations in place for your child's anxiety, social communication challenges? Are there interventions in place in terms of the strategies, what to do, the buddy process? Are they building social connections? Are they doing small groups in the room? Do they know how to question, when to question, with who to question? Are they doing friendship groups? Are they doing a recess bunch? Is there a counselor that can work with this child? Is this set up? It's almost like it has to be set up. The plan has to be in place. You can't push a child into a situation that there's no plan for them. And so when the mom is saying reinforcers, to me, that's like if you go to school, you get a prize, and that's great. And maybe that's needed. But is the school set up from an accommodation intervention plan appropriate for this child with respect to their stages of communication, as well as their understanding the factors into what might be maintaining or causing the child to not communicate appropriately? And I will say one of the number one things we need to do, and there was no age mentioned. So I don't know if this is a preschooler, an elementary age child, a high school age child. I have no idea. But I would say that the older they are, the more involved they are in this process. But no matter whether they're in preschool or high school, peer connections, connections are critical. And often, if I were to say, what is the number one reason why children are very avoidant of school? It's lack of social connections and lack of social communication confidence. So that to me is what I'd want to dive into with this family.
And then that's the buddy process, right? That we've had a podcast on just on that.
Yeah, they need to figure out how to help with peer connections. It's not just buddies in school, but maybe there's neighbor friends. Maybe that's building social confidence with same age peers that are, cousins. Get that started. Are there clubs? Are there activities? Are there skills building the confidence? Again, I don't know anything about this child other than that one focus of how do we get the kid into school? And I'm backing up going, tell me, like, I want to understand this child. What are her needs? And how do we set up the best plan for this child at home, with peers, with family members, the strategies, the interventions for progression, out and about in the real world, clubs, activities, respecting her comfort, but also the school-based accommodations interventions. They need to be in place.
So it sounds like feeling like you belong is the key, with school.
Yeah, you gotta feel connected. Most children get excited to see their friends. Yes, they're learning. And of course, as they
Mhm.
get older, the more excited they tend to be about learning, especially an area of interest. But for most part, it's seeing my friends. That's who they light
Totally.
up about. And
That's
so
definitely why I went to school.
yeah, that's why you went, right?
Yeah,
Yeah.
definitely.
Let's say this mother comes back and goes, she's friends with everyone in the class. She loves the kids. And if she's avoidant of school, then I dive into what else would be causing her to be avoidant. Is she being bullied by
Mm.
somebody out of her class? That's probably rare because if she's feeling good socially, she should be wanting to go to school. But if she is feeling good socially and she's still avoidant of school, then it's something academic. It's something that's causing her stress within the school.
Like
It's
a learning
something.
disability? Is that what you're implying?
I'm not saying a learning disability. It could be something learning wise. Maybe the teacher misunderstands her. Maybe the teacher is asking open ended, thought provoking questions in the middle of a classroom and
Mm.
expecting the child to answer, and she doesn't necessarily communicate with the teacher. Maybe she's starting to one on one. Maybe she's not. Maybe she's mute with teachers. Maybe she's verbal with peers. Maybe she's verbal with teachers and mute with peers. I don't know, but I would want to have an understanding to be able to guide the teachers to be able to develop and have a very kind of supportive environment that's meeting that child's individual needs. And rarely do children refuse to go. And if minimal, at the minimal, we can transition them in. Maybe it's a separation in the morning from the parent. Maybe that's all it is. But I think what you're hearing from me is the classroom environment set up for success?
Totally. Okay. Question number 4. Our 4.5-year-old son was diagnosed with SM just before his 4th birthday and was also diagnosed with ARFID and encopresis. Although he showed some improvement using strategies recommended by a psychologist, we did not feel she was the best fit. After multiple conversations about how debilitating his anxiety was, she refused to recommend an SSRI. The psychologist recommended we have another few sessions to discuss relapse prevention. I prefer to cut ties with the psychologist, but I'm interested in your thoughts. Should I be concerned about relapse prevention?
This is an interesting question. Well, first of all, I want to just say what ARFID is for our listeners. It's an avoidant
Mm-hmm.
restrictive food intake disorder. And we have a whole podcast on this. This is when children
Yep.
have like eating challenges, issues.
It was episode 29 with Dr. Megan Fay, Consequences of Untreated Eating Disorders. We get into ARFID that episode.
Yeah, that was basically about ARFID, frankly. That was an ARFID episode.
And then encopresis, what's that?
Encopresis is a medical term. It's when children withhold going to the bathroom number 2, and they often like hold it, and they can have difficulty going to the bathroom. It often leads to severe constipation because they don't go. It's definitely anxiety related for some. So ARFID as well. ARFID could be sensory based, and encopresis has a role in that too. But anyway, just wanted to say that briefly for the listeners. I want to respect and not know specifically what this psychologist had in mind. So there are families that will come to the Smart Center with an agenda of, I want meds. We do the evaluation, the selective mutism eval. We begin treatment, and we realize, you know what, this child can do really well without medication. Let's do this. Let's do that. Let's implement these strategies, train the parents in this way, put together these school-based accommodations, intervention. The child gets through treatment, and some quicker than others. And I would say to the family, I don't know that you need medication. So that's important to recognize. I don't know if the psychologist felt this. If this child had a lot of comorbidities, comorbid anxieties, generalized anxiety, social anxiety, really impacting the child's ability to function. So even as the SM was being treated, the child still had a lot of anxiety surrounding like generalized specific phobias, maybe other anxieties, maybe depression. Those are the kids I may most likely prescribe medication to as a adjunct to treatment. That's how I think. That doesn't mean that this therapist didn't think like that. She may have just felt she didn't need it. And I'm always willing to talk to the family. And there's times the family really has a strong opinion on it. And I think to myself, medication would be an adjunct. I don't know that I would do it right now. Let's give it a few more sessions. Or, you know, these are reasons we would use medication. So I do want to respect that psychologist. opinion. I also feel working with someone that prescribes medication is also a good idea. One of the beauties of what we do is that because I prescribe and we treat, we piggyback a lot of this. We titrate the medication along with the treatment and will guide going up or staying lower and how we're dosing by the treatment itself. So we're not necessarily up the dose. So if any of our listeners are using medication with a specific doctor and doing treatment for SM with a different therapist, highly recommend that you connect together because they should not be done independently, where meds go up, and the treatment. I mean, if a child's doing well, why do we need to go up? Because you want the child to build the long-term coping skills. So the relapse prevention, I'm really not sure what that means here. I know what relapse prevention means. It means how do we prevent your child from going back to SM? I've never done a relapse prevention session because during the treatment, we are training parents on how to accommodate their child, how to provide the interventions, how to bridge up, how to bridge down, when to bridge down. We're doing the same with the teachers. So by the time the child has kind of reached the point of, hey, listen, you're good. She's functioning in all settings. She's functioning socially, emotionally, communicatively, academically. They've have the skills. And then we talk as we're going through treatment again, how to accommodate when life gets a little bit tough. Because children, if they've built those skills, will not relapse to mutism again. It doesn't happen if they've built the skills in treatment. So my guess is this particular psychologist, with all due respect, wants to just make sure and maybe troubleshoot with the family. If you trust this psychologist, I would think that this psychologist has reasons for these two visits. In my opinion, if the family's like, look, I really don't, this isn't working for me, then you need to either find a new therapist or take a break. So I'm certainly not going to tell the parents what to do. But I would hope that when a family is working with a therapist, they have that connection and trust. And from what was written in here, it sounds like there's some doubt from the parents about that connection and trust. And so that's an important message. And if somebody feels that way, you shouldn't be forced to stay with somebody.
What about the idea of maybe stopping seeing this specific psychologist, but seeking out another psychologist?
Well, I use the word functioning. It sounds like this psychologist feels this child has reached a point where she's doing really well. And well to me means you're functioning. You can get your needs met. You're verbal. You may not be the chattiest, most elaborate, outgoing child in the class, but you're functioning socially. You're doing pretty well. You're functioning academically. You're doing pretty well. You're having the proper accommodations, interventions. Socially, you're connecting with peers. You have some friends. You feel you're functioning academically as well as communicatively. So what I would say to the parents, do you feel this is true, that your child is at a place where they're functioning well in these settings, that you could take a break for a while without jumping right into therapy? Or do you feel there's areas that your child is still struggling a bit? For example, you could have a child that's verbal in all settings, but they're not initiative. They're not elaborative. They're not expressive. They don't have great conversation starters or conversation expanders. It's difficult for them. They're having difficulty maintaining friendship. These are areas that absolutely you still want to work on.
Let's move on to the fifth and final question of this episode. I'm a speech and language professional and a parent to a 4-year-old that I suspect may have SM. I've been doing a lot of research lately and I've come across some advice on the importance of labeling praise for talking. For example, saying things like, I like how you use your brave voice is a form of positive reinforcement. However, on a recent episode of Unspoken Words, Dr. E mentions that we shouldn't bring attention to the fact that our kids spoke. This makes sense to me since the attention piece is part of the fear and anxiety. Can you talk through this more? Is there a time and place for verbally praising their brave talking, or should we always just play it cool and just reflect on what we heard them say?
This is such a great question, Brandon, because I think this is where confusions come in. Our approach is social comfort precedes communication. So that's the baseline. The focus on talking or being a brave talker, to me, if the child is ready to talk about talking, we talk about talking. But many families present to the Smart Center with such a focus on talking that child is so avoidant of talking. And Many develop speech phobia. They're stuck against the nonverbal wall. There's so much pressure to speak that it becomes a reinforced avoidance and heightened anxiety. People focus on selective mutism. And as you know, mutism is a symptom. If you focus only on the symptom without understanding, then you're basically only reinforcing what they can't do. And I feel our kids are brave showing up in many cases. So we want to understand the child's baseline. We want to understand the factors. Is this child a timid child, a sensory child? Like, what else is going on with this child? And really adapt the treatment to that child's unique needs. Even as young as 4, they can relate to a feeling, something being scared, scary, or overwhelming. 4-year-olds understand the bridge in terms of pointing, telling mom, using words. We often take the word talk out of it and talk about using words. And we will play games. Now, the younger the child, the more the goals are very parent directed. So it's called silent goals, where we will train parents on what strategies, interventions to use to bring them into social communication, how to set up the play dates, how do you question during the play dates, training the parents, how to buddy the child up, how to question, when to question, with who to question, what do you use when you question. All of that has to go on in the background. And once that's in place, children will make progress just by that, by teaching the selective mutism triangle, to be able to not say, tell them this, but asking a choice if need be to bring them into the social communication, re-asking, no answer, tell me, and bring it in, really respecting their stages on the bridge. And what happens is, by respecting stages on the bridge and children knowing where they're at on the bridge, even as young as 4, they're brave just showing up. So if we focus only on talking, when they're not there yet, you're reinforcing. But we do talk about talking when they're ready. And by opening up and not pressuring about talking too quickly, it's amazing how the children come around and they themselves start saying what they're doing. Like, mommy, I talked here. And we train the parents not to jump up and down and say, well, now that you talked here, you should be talking there. Or the more you talk, this or that. We say, hey, you must have been comfortable. Proud of you for playing that game, and then move on to something else. It's how you talk about it. So I want our listeners to understand, I do know that our ultimate goal is to become a confident, social, verbal communicator. We know that, but we have to be careful with how we talk about talking and when we talk about talking. I don't ignore it. If a child mentions it, we acknowledge it. If a child is working on telling mom at a restaurant because we're now using our voice towards someone safe, they're kind of writing where they're at on their bridge and they're playing the games. So by training parents how to set up games, so they're playing a give my order game or a scavenger hunt game or a guess who game or a hi bye game or a sandwich question game. I mean, we have thousands of games, and with each game, there's all different ways to play it based on that child's kind of presentation. By playing games, getting points for playing games, getting rewards for playing the games, the child starts to make the progress and starts to cross the bridge to become verbal. So it's amazing by just the way you question, when you question, how you set up that game through the use of visuals, perhaps by going to smaller, less crowded, less overwhelming places for the sensory child. You're going to see more progress. And the child himself or herself is going to start to see, mommy, I use my words there. I talk there. And you acknowledge it. And I have kids talk about talking all the time because they're ready to talk about talking. So it's a fine balance. It's a nuance. It's an intuition. And what I think this mother is saying is this child was being rushed to focus too much on talking. Not that she was being rushed. The parent senses it was too much of a focus on talking too soon for her child. And she realizes she wasn't necessarily in that place yet. But she's a speech pathologist. She has more intuition than maybe others that don't have that experience. So what she's saying is my gut is saying, hey, people were talking about being really brave to talk when she wasn't really ready to be brave to talk. Also know if you're practicing goals in a loud, large, lots of people environment for a very sensory defensive, sensory overwhelmed child, you're not going to have the success. And then you're going to be like brave talking. You're basically throwing the child into an environment that's not successful because it's overwhelming them, or they have an expressive language challenge. So putting their thoughts together to say it is difficult, but we're asking them without pre-planning, without a visual script, to go up to a complete stranger when they're timid to ask a question spontaneously out of the clear air. So it's how we set this all up to get that success so the child is safe to talk about talking and doesn't feel it as pressure, but that this is where we're going and I'm going to get there. Even at 4, it's amazing to see these kids draw themselves on a bridge and rate their feelings. It's incredible.
That's really interesting. All right, well, I think we're at time. Thank you for answering another 5 questions from the audience. This wraps up our latest installment of Ask Dr. E, and we will see you guys next time.
All right, everyone. Have a great day. If you have questions on anything covered in this podcast episode, we want to answer them. Please head to selectivemutismcenter.org/ask DRE. And we'll do our very best to answer them in upcoming podcast episodes, Smart Center newsletters, and on social media. Thank you.